Hi, this is Dr. Dumestri. Thank you for this question. So this patient is undergoing a double mastectomy for breast cancer purposes. They're going to have deep flap reconstruction. That's why they're talking about that scar along the belly. And they're wondering, what are the scars going to be like on the breast? So this actually applies to whether or not you're having deep flap reconstruction or implant reconstruction, and it depends on a few factors. So there's a couple different scenarios. So if we look here, the words are all reversed, but if you are getting a nipple-sparing mastectomy, so the tumor is not too close to the nipple is not going to be removed, then there's two possible incision patterns. One is under the breast. So this one is very well concealed. It goes right along the breast fold. The breast gland is removed through there. The reconstruction is done through there. Very aesthetically pleasing. The second incision for a nipple-sparing mastectomy is a vertical incision that goes from the areola down to the base of the breast. This is typically done if you've got a larger breast or a long breast. So for the general surgeon to be able to access all of that breast gland, get up as high as they need to, sometimes they'll do that. Or if we're planning for a future lift, those are the incisions that I make anyways, so we do that for ease of access. Also very aesthetically pleasing. It's a very common incision for cosmetic breast lifts, breast reduction that tends to heal really nice. Now the second scenario is you are having your nipple removed, so you are not a candidate for a nipple-sparing mastectomy. And again, there's two possible scenarios. So the first one is you do not need a lift, so you don't have a ton of breast gland. In this case, the general surgeon removes the nipple through an elliptical incision there and removes the breast gland with the nipple attached. That basically leaves you with, again, that vertical incision that goes down from where the nipple used to be down there, and you can then get some tattooing, or I can do a little nipple graft there, and then you get the tattoo around. So ultimately, again, it looks like you've had a little lift. And then finally, you're not a candidate for nipple sparing. You've got pretty droopy breasts, and we're going to want to downsize and cinch everything higher on your chest wall. In that case, I use the bottom of the breast incision 2 because I end up removing tissue, skin from the bottom of the breast, cinching it all tight. And then same thing, you can get your tattoo or a little nipple graft and tattoo. Hope that helps. Let me know if you have any other questions regarding that. Have a great day.